So ladies and gentlemen, please join me in welcoming Dr. Sabrina Smith from the ATA.
Free Frank, born a slave, had a vision of freedom and self-determination. He purchased his wife's freedom, and then he purchased his own, ensuring that future children would be born free. Now stick with me for a moment, because the story does have a point. Once free, where do you think Frank would go? Well, none other than here in Illinois. Now, Free Frank became the first freed African American to establish a town site, but it was not just any town. It was a multi-racial town. So I'm sure you're asking yourself, how? Frank was not only a slave, he was an entrepreneur of the antebellum. Entrepreneurs are usually known as wheelers and dealers and movers and shakers. But I like the notion of go-getter, risk-taker, problem solver. For Frank, he recognized early on the economic value of slavery. So that's where he took the fight. There were those that helped him along the way, but it was his entrepreneurial spirit that led to action. He achieved what many only dreamed of. Let me ask you, how do you all respond as a collective, as the ITN network, as individuals, when you're faced with insurmountable challenges? Like Frank, I think we need to have an entrepreneurial mindset. Without it, we cannot build or design a future. So let me ask you some questions. Do we believe that entrepreneurs are fundamentally different than you or me? Now, before you answer that question, let's take a look at some of their attributes. Let's see what makes them tick, and let's see what makes them successful. I actually think that they're driven by the 4 C's. They crave the challenge to push themselves outside of their comfort zone. A little bit of what you're doing here with the network. And they have a change mindset. And they have a natural curiosity for what if. They love to take calculated risk, and they adapt to the situations around them. And I think this is a key one too, is that they have a willingness to fail. But there's something else that they need. They need grit. Grit is raw, it is courage, it is passion, it is backbone. And one of my favorite is the resolve to face the unpleasantness of the duty. I think it's fair to say that an entrepreneurial spirit and grit go hand in hand. When I look out at all of you and I look at the efforts of the ITN network and the hospital systems, I know that you all have it because we're in healthcare. We have to have it. This is a tough business. But let's get back to Frank for a little bit and see what happened on his journey. It was not easy for Frank getting from Kentucky to Illinois with a wife and family in tow. There were many obstacles along the way. He and his family had to risk being captured and resold back into slavery. And then he had to cross the mighty Mississippi River. For Frank, crossing the Mississippi River, even though it was difficult and I'm sure challenging at times, represented access to freedom. But Frank has something in common with you here in Illinois. Like Frank, Illinois has accomplished great feats. Growing up, I was taught how Illinoisans came together to rebuild Chicago after the Great Chicago Fire. You built the tallest building in North America, and you've established world-class healthcare institutions and universities that none of our kids can get into because of all of the requirements. But you're starting to build a technological hub and transforming your economy. And I would be remiss to say if I did not mention the rolling farmlands. Driving in from St. Louis here, I was just awestruck about how beautiful the country is. But there are always more challenges that we have to face day to day. Once Frank crossed the Mississippi River, his journey was far from over. Just north of his destination, he encountered the worst snowstorm on record in Illinois, and he was snowbound for 2 months. From what I know of Frank, I'm sure that he was a planner, and he took this time to take a step back and strategize. Like Frank on his journey toward freedom, Illinois has hurdles to overcome in its healthcare marketplace. And I'm not telling you anything that you don't already know, but let's kind of go over this just a little bit. The Prairie State, while we're making some strides, could have done a little bit better. In attempts to provide access and control costs and manage risk and increase your margin, the marketplace has become fully fledged with mergers and affiliations. Health disparities between whites and blacks continue to prevail. And the race is on with payers utilizing narrow networks as their lever of choice and expanding unprecedented risk arrangements. In response, employers and non-conventional healthcare stakeholders are moving in quickly and actively, redefining, and should I dare say this, our value chain. This is compounded by a pervasive digital, data-driven culture. But it is this digital culture that can provide us with a new framework. Virtual care and the fusions of new technologies combined with AI and machine learning will play a key role in supporting innovative healthcare strategies that reshape our understanding of the healthcare delivery system. We will engage consumers in radically new and different ways. But it's important to remember as we're building that telemedicine and telehealth is not just an add-on service or a point solution. It must become the very fiber of our organizations. The marketplace will continue to strive toward value and quality, as it should. However, the policy infrastructure needed to support this new era of healthcare delivery is lagging way far behind. But make no mistake, this is a booming industry with or without the reimbursement. It is estimated to grow to $40 billion by 2021. At the federal level, we had some great wins last year with Medicare reimbursement for remote patient monitoring, and then telehealth reform came through with the Chronic Care Act. This legislation will lay the groundwork for future health reforms to achieve a more patient-centered, cost-effective, and modernized healthcare system. Last year, ATA co-sponsored with the U.S. Senate Broadband Caucus an expo, where we continue to push and reiterate the need for innovative and expanded broadband coverage. Yes, progress is being made, but we must continue to press forward. Well, there's always a silver lining, right? Eventually, Frank reached his destination in Pike County. It was hard going for a while, but he was able to establish his town and live there for many years until his death. All of his children and his grandchildren freed. He accomplished his original goal. Free Frank, born a slave, broke all stereotypes and accomplished something that no one else thought that he could do. He has a bust in the Abraham Lincoln Presidential Library, and last year he was inducted into the Smithsonian exhibit, The Nation We Build Together. Free Frank is my great-great-great-grandfather. And now I have a special affinity to Illinois. So I'm not going away. But the archaeologist, Dr. Shacko, that oversaw the dig of New Philadelphia had this to say. Frank McWhorter demonstrates the possibility of change based on what we can only call the birth of an American spirit of freedom. The noble people of New Philadelphia were living up to the American dream in spite of what shape the nation was in at the time. This is Frank's legacy. But what will be our legacy? What will history write about us? I like to think that as we embrace this digital culture, combined with new modalities of virtual care, data capabilities, and medical innovations, that we all here today can redesign our healthcare system together. I share this story because there is no doubt that this is going to be challenging. But for those of us that see the vision of a transformed system, we must continue to work together. Let's create another first here in Illinois. But make no mistake, this is tough work, and all of you live it every day. It's difficult, it's trying, it's complex, and it's rewarding. This is a business, there's no doubt. But as Mary said, we do this because we care about people and we care about our communities. Like Frank, there are people counting on us to cross our Mississippi River, to make it through our snowstorm, and to establish our town. So here's the charge. There is no lack of entrepreneurial spirit in this room. There is no lack of grit, and there is no lack of opportunity. But what is extremely important is that we must continue to work together. Our healthcare system has been in crisis for years, and patchwork is not going to fix it. We have an opportunity here. We have all the tools at our disposal. So I'm committed to this, and I think that every single one of you is too. I strongly believe that we can do this. So let's do this. Thank you.